The first step of the primary assessment is to form a general impression. I am able to tell that the patient is unconscious and laying in the supine position, surrounded by flat, level ground. There is no bleeding or visible wounds. The patient is male and seems to be above middle age. Now I'm going to introduce myself and speak to him as if he is conscious. Hello, my name is Julia and I am an EMS provider. Today I'll be providing you with first aid. Because he is unconscious, I have to assume implied consent. His chief of complaint is unclear because he is unconscious, but those around him called 911 when he was found. They don't know what happened. Because he is unconscious and in this position, he could have a spinal injury. And now I'm going to assess for major life threat. I am able to feel a pulse and I see him breathing normally. There is no major bleeding or visible wounds. Now I'm going to assess his level of consciousness using the AVPU method. He is not responsive to verbal or painful stimuli, meaning he is unresponsive. And because of this, his A&O score is 0. He is unable to identify any of the 4 questions. Now I'm going to assess his airway. His airways seem to be clear. However, because he is unconscious, I am going to perform the jaw thrust maneuver by pushing his jaw down without moving his head or neck. Now I'm going to take his respirations. He's taking in a normal amount of respirations, 15 per minute, and all of them are equal and normal in depth. Now I'm going to take his carotid pulse. His pulse is normal with 80 beats per minute, and it is strong and round. Now I'm going to take note of his perfusion status. His skin color, temperature, and moisture all seem to be normal. And that concludes the primary assessment.